Oh hi, I'm Chase Creighton, and welcome to my Eagle Scout project. If you're watching this, chances are that very soon you are going to have surgery. If surgery is new for you, you might feel a little bit anxious, and that's okay. In this video, I'll tell you all about having surgery by using my years of experience. You see, when it comes to having surgery, I'm what you call a frequent flyer. In my life, I've had lots of surgeries. When I was born, I had severe scoliosis, which means my spine was curved sideways. I also had lung problems, which made breathing and talking difficult. I had my first surgery when I was 10 months old. By the time I was 17, I had been in surgery 30 times and spent many months in hospitals. Over the years, I've learned that being in the hospital and having surgery don't need to be feared. In fact, I believe what I've experienced has made me stronger, and I want to share what I've learned with you. For me, the day before a surgery is a special day. That's when my family does something fun together, whether it's some big trip out, watching a movie, or playing a game at home. We do something enjoyable that keeps our minds off surgery. Remember, you can't eat or drink anything the night before your surgery. Make sure to pack your bag that day, and don't forget to bring your favorite stuffed animal or blanket. That night, try to get some rest. You might have to get up pretty early on the big day. When it's time to go to the hospital, don't forget your bag. On your way, you might feel nervous. Try to relax. Tell yourself everything is going to be okay. You may also be tired and hungry, but don't worry, you don't have much to do today. When you get to the hospital, your parents will check in with the receptionist. Then, you will hang out in the waiting room until your name is called. Finally, a nurse will take you and your parents to your pre-op room. In the pre-op room is a bed, some chairs, and a TV. Someone from registration will come to talk to you and give you a cool bracelet with your name on it. After that, you get to meet your surgeon. You can relax. This might take some time. While you wait, you can watch TV, movies, read a book, or play games. When your surgeon arrives, he or she will tell you about your procedure. Sometimes they write their initials on the part they are fixing, kind of like a cool, temporary tattoo. Then, a nurse will give you a gown to change into and a space blanket to keep you warm. After collecting your height and weight, she will take your vitals, which are your blood pressure with a cuff that squeezes your arm, your temperature with a scanner or thermometer, and your blood oxygenation with a finger clamp. Then, the anesthesiologist will visit and give you a medicine that will make you feel funny. This is to make sure you don't feel anything during the surgery. After some time, a nurse will come to take you to the operating room. You'll be able to say goodbye to your parents at the kissing corner, and then you'll be moved through the blue halls to the operating room. The operating room is very clean, bright, and cold. The doctors and nurses in the OR will be dressed in masks and hats. The nurses will move you to another bed. Then they will give you a mask to breathe in the weird smelling gas called anesthetic, and the surgeon will do the procedure. Don't worry, you won't feel anything. The next thing you know, you'll wake up in the recovery room. The nurses will watch your vitals using some tubes and wires. The wires make sure your vitals are okay, and the tube is connected to a bag that will give you water. While in the recovery room, you might feel tired and go back to sleep. You may not even remember being there. Once you're awake enough and feel like it, you can have popsicles, a drink, or some crackers. If you're staying in the hospital, you'll be wheeled to the Keystone Pediatric Unit, or KPU, in the Purple Tower. The KPU is the place to be. It has a calm and relaxing atmosphere with huge patient rooms. It has a bed for you, a bed for your parents, a recliner, and a TV. The KPU also has a playroom with toys, movies, and books, and it has a game cart so you can play video games. The Child Life Specialist will show you all the fun stuff to do. Once you're able to get around and feel well enough, you'll be discharged to go home with your family. See, surgery in hospitals aren't that scary, and sometimes it can be fun. Just remember to let the doctors and staff do their work, and everything will be fine. I'm Chase Creighton, and I'm here to tell you, when it comes to having surgery, you can sit back, relax, and enjoy the flight.